Then we'll go from there.
Okay, thank you. Thank you all for being here. Um, I want to um, just start with a disclaimer that I'm not gonna overtly give medical advice or talk overtly about insurance because that's a whole nother work, and I'm not licensed anymore to give medical advice, but I can give a lot of experience, strength, and hope from what I've learned from being a nurse practitioner for a long time. I've started nurse practitioner programs, I've taught nurse practitioners, and probably most effectively been able to case manage and navigate my healthcare needs as I find as I age and the medical system turns into a business model. It takes a lot of finesse to get what you want out of healthcare. And so that's part of why I title this. And I just want to make sure that you can all see and hear me okay before I proceed. Are we all good?
Yeah, I think we're all okay.
Yep.
Okay. Um, this is an overview of the things I'm going to talk about. I just want to that there are a lot of barriers that affect who we are when we enter the
Hold on
medical.
a second, Melissa.
Yep.
You're not screen sharing at the moment. I'm not seeing your slides.
Okay.
It was there at the very, very beginning and then disappeared.
Thank you for letting me know.
Oops, that's not it.
Well, let me open the presentation again.
There you go. There we go. Okay.
When I talk about healthcare visits, I'm including doctor visits, nurse practitioner visits, visits to physical therapy, chiropractors, the whole myriad of specialists that we see. And there's a lot of logistics about getting what you need, working what I'll call working the system. And the barriers to being seen and heard have to do with the assumptions about how we've been treated in the past and the assumptions of providers make about us. Um, then we'll talk about mindset and how to prepare for the appointment in terms of knowing what you want and psyching out what they're looking for and expecting to hear from you. And that'll help you to be prepared and take ownership and in some ways take control of the meeting. So we don't have to walk in there and just sort of be passive and have them say and do to us what they will do unless we, meet them and take ownership of what's happening. I'll also talk about ongoing communications because in between appointments, every office has their own um, approach for portals or um, phoning in, and also touching on being seen in a timely way. Sometimes office visits are important. Sometimes you need to go to urgent care and emergency room, and so I'll touch on that as well. Um, my approach is to really plant a lot of seeds for thought. So I really encourage you to put, your responses and thoughts in the chat so we can talk about it at the end. Because there's kind of a lot of information here. There are a lot of barriers to being seen and heard, and this model of the systemic, the external isms that we all face. There are structural issues in terms of insurance companies, which are having an increased effect on how much time the providers have, how many patients they're expected to see, what they're allowed to treat. And so in some ways, getting a view of what they're experiencing helps us recognize their humanity. So it's not so much an us and them mentality. I may bring it up so it sounds like that, but in fact, my lived experience is that by and large, most people are doing the best they can, and that by appealing to the humanity of the people around us, I find it opens up a chance for them to show theirs. And the last thing is that unexamined beliefs we all carry a lot around, and we all have come to terms with internalized homophobia, but in fact, the homophobia that providers have can be a factor. In the category of expectations and assumptions, these are some of the big categories that both patients that we carry and providers carry. And I will say, as recently as this week, a nurse practitioner that I saw in a practice said something that was very ageist to me, and I really decided not to bring it up because she was just sort of a gatekeeper and not a provider of care. But there's a lot of ageism. Providers will minimize our symptoms and say, "Oh, it's just because of age," and a lot of that is baloney. Classism is a factor that I would say for people in our generation has probably affected the way that many people have approached medical providers, thinking, oh, they're the expert. And some of those providers say, well, I'm the expert. They have what's quote unquote a God complex. And that's basically classism that comes and goes with it's part of the education that happens in the medical model. Misogyny, we've all lived with and experienced, and it's a pervasive factor of our culture. And there's a real gender differential still in when there's a gender differential in the payment model of insurance, in who the providers are, in the research that's done about treatments. Misogyny is a real factor that can affect the quality of care that we receive. Homophobia, I would suspect that we all have stories where we've experienced homophobia, and it may be a factor that affects our decision not to get health care because it's sometimes unspoken and sometimes overt. And there are providers that sometimes think they have something to prove when you come out to them. And there are lots of providers available. And so if there's a bad experience, it is not necessary to tolerate it. Racism is another factor that influences a lot of dynamics. And these are all issues that affect the way that we're seen, the way people interpret what we say, and the other kinds of things that I've talked about. So all of this affects the scale that as we're walking in wanting information about something that's going on, we may have hesitated making the appointment until we're so sick that we just can't stand it anymore. But the fact is, when we are at our most vulnerable because we're sick, we have to confront a lot of these potential barriers. And I will say the red flag for me that has resulted in me leaving providers most quickly is when they're patronizing. I have zero tolerance for people who are patronizing, whether or not it's based in any of these isms. These are some of the things that we can do. The important mindset is to remember that we employ these providers. They're not there doing us a favor. They are our employees. They are paid because we are seeking care. And that mindset can you can get a lot of traction out of that. It doesn't mean you have to bring that up, but again, for people in our generation, approach considering a provider as an equal is not what we were raised by and not what our parents were raised by. Um, Another thing to keep in mind is that we know and we are the expert at our bodies, and it's important not to um, allow anyone to minimize our sense of what our symptoms are. We are the expert of our bodies, not them. We are at an age where, and hopefully you don't have to wait until we get to our age to trust our intuition. That if you have a hunch that something's not right, it's important to honor that hunch. And it can take a lot of work to bang on the doors and get an appointment and get in there. But if there's something about your intuition that says something's not right, honor that. It's important to be prepared with questions when you come to an appointment, and I will show you some examples of how to frame that. And I will say, write them down because it's easy to get flustered getting in the door, getting past the gatekeepers, but being prepared and bringing those questions can really help you set the stage to set an agenda. And so very often what happens when I walk in, after the greetings, I'll say, these are the questions that I have. This is what I want to know. And it lets them know that this is a dialogue, that you're not just there to be the recipient of their input and their expertise. And you will be surprised how many providers find this really helpful. It's important to know what you want and that you can own this. Of course, you're insisting on the fact that we will be treated with respect. We want information and explanations about what's wrong. I don't want to just be told what to do. I want to know what's going on, why this is happening. I also want a recommendation. And very often, uh, if you're given a choice of A, B, or C, depending on your relationship with the provider, what I will say is, what would you tell your sister to do? And it really catches them off guard and helps to um, lower the barriers of them protecting themselves and trying to get through this in time to humanize and personalize what's going on. It's important to know that you can be offered choices and you can ask for choices, and also to when you can expect changes. Very often, if you're told to start a medication, you don't want to start it. But and say, okay, well, if I do it, how long is it going to take before I notice a change? So I can say I know how long it takes me to respond to an antibiotic. And if in those number of days I'm not seeing a change, I will get in touch with the practice and say, I need a different antibiotic. This isn't working. But that's partly because over the years I've come to recognize how my body responds to antibiotics. because of some chronic illnesses. So preparation is very important. This next series of things called preparing for the visit, these questions are what's in the mind's eye of the provider, that they're going to try to work out for themselves. What have you done? What makes it better? What makes it worse? How long has it been going on? Those are the questions that they will ask you. So if you come prepared with those answers, it's going to streamline the time you have in the very compressed office visit to get to what you want. You may have had a symptom and tried a heating pad, or you tried a supplement, or if you have an ache or pain, does rest make it better? Does movement make it better? And similarly, what makes it worse? Does applying heat or cold make it worse? Do you notice the pain during the night? Are you coughing during the night? Is it keeping you awake? These are the kind of questions that help them drill down into being precise about what's going on. And how long has it been going on? Can be a harder thing to figure out, because so often we live with things for a long time before we decide to do something about it. So trying to be retrospective in your thinking so that you can consider, this has been going on for a few months and I ignored it, and then I tried this. And that helps them know that this is not something that happened yesterday when something stressful happened. So these are very important questions. The next thing about writing out your questions and informing the gatekeepers is very important. We've talked about writing out your questions, but when you are escorted into the examining room, the person that checks your weight and your blood pressure is basically a gatekeeper, and they are pre-screening you so that they can inform the provider what they should focus on. It helps the provider focus in instead of starting from scratch. So don't be shy about saying, I'm here because I've had this pain and I've had it this long and I need to know what to do about it, or I've had this infection, or whatever it is. You don't have to give them the whole story, but don't overlook their importance in the domino effect of how to get what you need from the system. Another thing that's important is to bring a list of all the medications you're taking, including your supplements. And the providers may well poo-poo your supplements, but there are a few supplements that do counteract with antibiotics, for example. So I tend to keep an updated list of my medications with me everywhere I go. And when you get the pre-screening form online, you can verify it, and sometimes when you get into the office, they'll ask you to look at a list of medications. But if you bring this list of medications, when the nursing assistant or medical assistant starts asking you, saying, are you taking this? Are you taking this? You just hand them the list, and it saves a lot of time. Caveat about medical testing. The way most medical providers operate is when they start coming up with thinking about a diagnosis, they will order tests to find out what's not going out. They operate by a rule out modality. This is especially true in emergency rooms where you may go in and they'll do 1,000 tests and you leave there and they say, well, you don't have this, this, and this, but they don't tell you what you do have. Similarly, in medical offices, they want to make sure that you do not have the worst case scenario, and you don't always find out what is going on. Our focus is to find out what is going on, which is why it's important to have this mindset about this is my symptom, this is how long it's been happening, this is what what can I expect, excuse me, when can I expect a change in this symptom? So if you seem like you're talking across purposes to a provider, in their mindset, they're trying to rule out or figure out what's not going on. And I hope that isn't confusing, but it really helps to clarify a lot of uh, the miscommunications that can happen. Before the visit and between visits, each office has their own specialty modality for how you can be in touch with them. Increasingly, more and more are having online portals. Some of them still rely on leaving messages. Um, the key thing here is to be persistent. Um, it's like with friends, there are some friends that will respond to an email, and some friends will respond to a text. Office practices are like this. Each one will respond to you based on what works best for them. And you have to figure that out. It's very time consuming, but persistence will pay off because there are gatekeepers. And the people who are gatekeepers that read the messages are often not qualified to decipher what you're saying. And it's important that you be persistent to make sure your message gets to the provider. And this can take a lot of persistence again and again and again. I want to say a word about trying to decide whether to be seen in an office or urgent care or an emergency room. As offices, and I'm talking about medical providers here, increasingly physician assistants, nurse practitioners, and doctors. Offices are so busy that if you call with a health problem, they'll say, well, I can see you in 2 or 3 weeks. And if you have something that is urgent, of course, you're going to go to the life-threatening, you're going to go to the emergency room. Increasingly urgent care or whatever they call it where you live, is picking up more and more of the office visits that need to be seen in a timely way. These are for things for infections, aches and pains, flu, COVID. And so if you're told you have to wait 2 to 3 weeks and it seems like you can't wait that long, don't wait that long. Find your local urgent care and go in there, and they will collaborate with your medical provider. So, in summary, getting what we want from medical providers, it depends on being prepared, knowing how to figure out what they're thinking, being clear and expressing what you want, being prepared and showing up, so that you can get what you need. You deserve good quality health care, and it is out there. And there are wonderful, wonderful healthcare providers. who started in this business because let me stop here. They started in the business of healthcare at a time that they wanted to help people before healthcare was a business. And 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 for the most part, they all operate not only from their head but from their heart. And you can, I find, by appealing to their heart and also treating them as equals and not letting in any isms, you can get what you need. Thank you. I see there's a lot in the chat.
Thanks, Melissa. So we're going to turn off the recording now, Janet.